And I'm going to share my screen. This was quite a bit of information as I started researching and compiling. So I wanted to share it in a little bit more of an organized way. And I'll send out a PDF of this PowerPoint too later today so that people can have it. So don't necessarily feel like you have to take notes unless that helps you integrate the information. So yeah, I really wanted to kind of start with, we know all of our names and locations and pronouns, and wanted to kind of start with just asking you if either one of you has a specific question about ticks or infection or prevention. And if you do, maybe just jot it down or hold it in your mind, and we'll make sure we address it if we haven't addressed it kind of going through this information in the presentation. So yes, you know that I got Lyme disease last summer, and I was bushwhacking through tall grass when I got that tick bite. It was in July, and I'm sure the tick that bit me was a nymph, because despite thorough checking, showering, washing my clothes, I never found a tick, and I never had a bullseye rash. But I just started, about 2 weeks after that bushwhacking experience, developing symptoms. And I thought of all different kinds of potential reasons why I was having those symptoms. I imagined, oh, it's my thyroid. Oh, I'm going into perimenopause. Oh, it's stress. All of these different reasons were coming up for me. But it's just that reminder that, often the most obvious thing is what's going on. But I'm glad I waited as long as I did to get blood work done, because often people will find a tick, and if it's been on for more than 36 hours, if it's engorged, those are risk factors for getting an infection, and they'll get blood work right away. And obviously, because tick-borne infections replicate really slowly, the blood work will look like nothing's going on. So it's actually good to wait a couple of weeks, as strange as that might seem, because then, once the infection shows up in blood work, we know we can take action. So I did not use oral antibiotics. I had the good fortune of using intramuscular ones, which preserved the health of my gut. And I think, really circulated in my system much more effectively because they bypassed the gut. And that was just a shot, an injection in the hip twice a week for a month. And all doctors know how to do this. All doctors have access to these antibiotics and can easily prescribe them. It's just not the standard of care because it seems easier to give somebody an oral antibiotic, but it's actually far less effective. And part of the reason that we have chronic conditions related to tick infections is that the doxycycline that's prescribed isn't effective, and it's so toxic to the gut that people won't finish their whole course of antibiotics because they feel so sick, right? So the doctor who helped me was laughing, and he was saying, we'll look back 20 years from now and say, gosh, why did we ever use oral antibiotics? They feel so antiquated. But hopefully that trend will start to, pick up and take speed. But you can always ask for the intramuscular antibiotics. And, some people feel comfortable doing it themselves at home. Other people just go into their local health center to have it done. But I do think that that's a much more effective treatment and much kinder to the body. And then I followed up with herbs. Cryptolepis, knotweed, and bicol skullcap, there's a ton of scientific research out there to back up the traditional wisdom around using these herbs. And I just did that because, I really wanted to make sure that I had cleared everything out of my system. And the nice thing about herbs, again, is that they're strong, but they're also kind to the body in terms of any repercussions. And actually, the research out there says that these 3 herbs in combination do a better job of treating tick-borne infections than oral doxycycline. So that's pretty amazing if you think about it. So I wanted to include this creepy, crawly picture of ticks, just because I think it's a good reminder to look at them and kind of remember what they're like, and that the nymph, this little one on the right, is probably what bit me, and it's the size of a poppy seed. So they're very, very small. And we do have all of these different ticks, right? Not only the black-legged tick, also known as the deer tick, that does transmit infections, but dog ticks, the American and the brown, and then the Lone Star tick, which has kind of like a white hourglass design on its back. And then the wood ticks, which are also known as the squirrel and woodchuck ticks. Now, we've learned recently that the Lone Star tick, which has been in the Northeast for a while, actually does transmit a virus that's very rare, but can be very harmful. So, if you find the bigger ticks on yourself, like the dog ticks or the wood ticks, you don't really have to be worried. But the Lone Star with that design, and then the little deer ticks, the black-legged ticks, it is good to check yourself out. And of course, ticks have this life cycle, right? And they need to feed in order to continue growing. And that's why in Vermont, we love it when winters are very, very cold, because that can stop ticks in their 2-year life cycle and kind of kill them off. Of course, more ticks will always come around, but part of what climate change does is it brings about the causes and conditions for the ticks to live through the winter. And then we have more ticks, right? And very familiar and friendly hosts for ticks over the winter are mice. So when we have more oak that is making acorns, our mouse population increases. This actually happened 2 winters ago. And so, kind of concomitantly with that, our tick population increases as well. So something to be aware of for sure. And be kind of watching the weather conditions and what's happening in nature in terms of thinking about ticks. So again, there's a lot of varying information out there about, when do I need to start kind of worrying about the potential for infection. And the biggies are, is it a black-legged tick? And in rare cases, also a Lone Star tick. Has the tick been attached for over a day, 36 hours or more? And is the tick engorged, right? So has it gone from that little poppy seed size to like the size of a sunflower seed? And they can get even a little bit bigger if it's an adult tick. And then, if you do find a tick and pull it off of yourself and you're concerned, just send it in. Tickreport.com. It's the zoology lab at UMass Amherst. And they do charge $50 to tell you if your tick is carrying pathogens. But I think it's money well spent for peace of mind. And if a tick, if you find it within 24 hours of known exposure, and especially if it's not engorged, there's really nothing to worry about, which is great. And I think it's just helpful for people to be able to kind of put their minds at ease around that. So all different kinds of tick-borne illnesses, right? It's not just about Lyme disease. There's Anaplasmosis, Babesiosis, Borrelia, Bartonella, Ehrlichiosis, of course, Lyme disease, and the Powassan virus, which can be transmitted by the Lone Star tick. And believe it or not, just 5 years ago, Vermont had the highest cases of reported Lyme disease in the United States, which just goes to show how much we're affected by climate change and how much our tick population is growing. 10 years ago, I wouldn't have even thought to check myself for ticks after being outside, and I always do now. It's just a different reality. So symptoms, right? After that 1 or 2 week time period of getting bitten, whether or not you ever find a tick, you can kind of know something's going on if you start feeling feverish or having night sweats. That's how it started for me, was the night sweats. And I was, changing the sheets every morning because I was sweating so much. Some people will develop a bullseye rash at the site of their bite, not all people. It's about half and half, actually. Some people will have muscle aches or joint pain, definitely brain fog or confusion. When I was really sick, I couldn't remember, I was trying to remember the name of the town, Richmond, Vermont. And I just couldn't pull up that name. So that's a sign. I also had the classic sort of tick-borne rash called erythema migrans. And it's called that because it migrates. It moves all over the body. It's little red circles, about that size, and they'll start popping up in different spots of the body on different days. I thought it was heat rash when I first saw it. It was very hot summer day and summertime. So, but that is the classic tick rash. Again, not everybody gets it. The other thing that will happen is someone will have tick paralysis. The part of their body, if the tick bites the arm, right, that arm won't move until the tick is removed. And then other people will develop Bell's palsy, which is paralysis of part of the face. So part of the face will be droopy, or people won't be able to chew on one side of their mouth. And then there's lockjaw, which I also developed, and that was the symptom that drove me to the urgent care to get my blood drawn. And I truly couldn't open my mouth. I couldn't even really eat anything, maybe just some applesauce. So those are some general symptoms. And then with different tick-borne infections, there are a few different symptoms. With anaplasmosis and ehrlichiosis, people might show up with some lung type symptoms, so some coughing, some difficulty breathing, and then a lot of abdominal pain, and kind of like pressure in the abdomen almost. Then Babesia, Borrelia, and Lyme, which is also a strain of Borrelia, do kind of have that hallmark fever and chills, kind of symptomatic process. And it's important to remember that with all of these, but especially with Babesia, it can be life-threatening to folks who have either an autoimmune condition or a depleted immune system. So we'll talk about this too, but strengthening the immune system really is key, because we're not always going to find every single tick that bites us, unfortunately. With Powassan and with Bartonella, which are becoming more common, some of the hallmark symptoms, unfortunately, are neurological and related to the brain. So meningitis and encephalitis, brain swelling can happen with these. Also, people can have seizures. They can develop tremors, all kinds of different neurological conditions. But these are a bit different in that people, yes, can get a fever, can feel weak, but will start vomiting fairly profusely. So there's a slightly different treatment for all of this, which is kind of why I share some of the symptoms. And just, if you're getting blood work done, make sure you're asking for testing of all of the different tick-borne infections. And if one of these infections, doesn't get treated within 2 to 3 weeks of the bite, it enters this next phase called the disseminating phase, which is kind of leading to it becoming chronic. So people will experience really severe fatigue, like not being able to get out of bed, and numbness and weakness in their joints and limbs, feeling like it's really hard to move, hard to even lift a glass. I've seen that for sure. People having to drink out of a straw because they're so weak. People seeing spots from their eyes, blurry vision, more rashiness, more brain fog and difficulty, thinking about more than one thing at once. And then cardiovascular symptoms, either heart palpitations or a slowed heart rate, or back and forth between the two, so an arrhythmia. And of course, gut upset as well. So very important to catch this and treat it. And I am not the person who usually suggests antibiotics, but in this acute case, I think they are the best course of action. And many providers will say doxycycline across the board for any tick-borne infection. However, it's important to, depending on the infection, have them, culture and figure out which antibiotic is going to be most effective for you, and asking for the intramuscular antibiotics, I think, is really, really helpful and far more effective and far easier for the body to handle. And then, as I said, following up with those 3 herbs, Cryptolepis, Baikal skullcap, and Japanese knotweed. And there's a company in upstate New York, Woodland Essence, that makes all of these. And they're wonderful. Go ahead, Judith.
Are on the earlier screen, it said knotweed and skullcap. Are these just the scientific names for those things? We're talking about the same 3 things.
That's right. Yes. Okay. Those are just the Latin names.
Thank you.
Good question. So prevention, right? There's so much that we can do preventatively. Avoiding woody and brushy areas, but also making sure we're not bushwhacking through tall grass, for example, or going in big piles of leaf litter, right? And then wearing a tick repellent that, I don't personally feel comfortable with DEET. I know some people do. I choose a non-DEET repellent, which is CDC approved. It's called Cedarside. It smells wonderful. It's very effective, and you can spray your body as well as your clothing with it. Some folks like to have clothing that's treated with permethrin, which is a chrysanthemum flower extract that's very effective. Ticks basically contact it and die. So you can either buy that pre-treated clothing, or you can buy an insect spray like Sawyer that is permethrin, and just spray your clothes, let them dry on a drying rack, and then you can wear them, for about 10 washes. So either approach is good, but I think just really helpful to feel more comfortable being outdoors, because we don't want to stop being in nature because of ticks. So with the permethrin spray, you don't want to use that on your skin, just because it's quite concentrated, because it has to absorb into the fabric of your clothing. So that is a bit more of a process if you do it yourself. I just wear latex gloves and put all of the clothes out on the drying rack and spray them, flip them, spray them, and that's it. Let them dry. But it is a good idea to wear gloves just in case you end up, touching the clothing while it's still wet. But once it's dry, it's totally fine to wear that clothing and have it touch your skin. And then if you have pets, really important to check your pets. And potentially take off your clothing before going inside, so that you don't have hitchhiker ticks coming into your house. And then I like to throw clothing into the dryer for about 10 minutes on high, if the clothing can tolerate that, because heat kills ticks. So that's a really simple and easy tool. If you have a dryer, you can always do that. Ticks like to hide in warm places on the body. So always making sure you're checking behind the knees, inside the legs, around the waist, under the arms and the armpits, behind the ears, and in and around the hair. I think every single tick I've ever found on myself or someone else has either been in the groin area or on the scalp. So it's good to check a couple times too, because especially with hair, ticks can kind of, grab onto hair and then slowly find their way to the scalp. But again, it can be on you for more than 24 hours and still not transmit infection. So you have time. And then with removing a tick, again, I feel like there's a ton of information out there about that. But this is, kind of the approved way from CDC, National Institutes of Health. And this is what I've seen too when I've watched a doctor remove a tick in a doctor's office. They use fine-tipped tweezers and just pull straight up, no wiggling or jerking or sideways pulling. And if some of the mouth parts remain attached, that's okay. They're not the ones transmitting infection. It's the body of the tick that is. That's the important part to remove. And obviously don't just, throw a tick out the door or the window. Make sure you either burn it or kill it with alcohol or flush it down the toilet. And then disinfect the area, wash your hands, and move on. And this is a quote I like to share because I think being anxious about anything, and especially about ticks, can just make matters worse, right? So Thich Nhat Hanh, in all of his wisdom, said, worrying does not accomplish anything. Even if you worry 20 times more, it will not change the situation, right? It'll only make things worse. And that's the truth with ticks as well, and our body's capacity to fight infection. When we worry, our nervous system goes into high alert and our immune system shuts down. So if there is an infection, our immune system is less capable of fighting it. I think really the best preventative tool that you can take internally, besides of course checking and using a tick repellent, is astragalus. And astragalus root has been known to specifically help the body's killer T cells, that part of the immune system that rushes to the scene of an infection, to neutralize, engulf and neutralize the spirochetes, the bacteria that come from ticks. So I recommend 1,000 milligrams of astragalus daily, as capsules. Usually that would be 2 capsules, or dropper form, 1 dropper of a tincture with every meal, really from April through November. I think if you've been out, that the ticks have already been very active and certainly start to become active in April. So important to give the body the best possible chance to fight off any infection. So that's just a little bit about what's going on with ticks and what to pay attention to. I feel like in many ways, this is just as an important of a concern as COVID. And ticks are always going to be around. And with climate change, there will be more and more. So certainly something to be paying attention to. What questions do you all have that I haven't addressed or touched on?
Where do you find cedar side?
Great question. I order it online. The company, I forget where they're based, actually, in the Midwest, Mary. Yeah, and I just usually have 3 or 4 bottles shipped at the beginning of the season, you know, in April, and you all wouldn't need as many, but we're, you know, we're always spraying down our kids as well, and it's great to have them around, you know, even have one at home and one in the car, and yeah, then you know you have that extra support. Great question. And the other piece, I think, preventatively that I didn't mention is keeping your lawn mowed, you know, which I'm sure most of us are doing, but ticks do love tall grass, even, you know, an inch tall, they like. So even just considering keeping the area around your home or apartment safe, having mowed grass is a really good way to do that. Or having chickens, because chickens eat ticks.
Mm-hmm. And May is no-mow month for the insects, for the pollinators.
That's right.
But
that's right.
We're going to be in apartment living, so.
Yeah. Yeah.
So we have to deal with whatever happens here.
Whatever they decide, right. All the more reason to be careful when the no-mow time is happening.
Well, no, they mow here. They mow.
Oh, they do? Yeah.
Yeah. Well, I'm not at our house. I was trying to convince my husband not to mow
right.
in May until we sell our house. You know,
yes.
Start mowing in June.
Yeah.
But maybe it's not a good idea this year.
Yeah, I don't know. Even that process of having to mow a lawn that hasn't been mowed could be, you know, stirring up a lot of ticks.
Yeah.
So, yeah, something to think about.
Do ticks serve any benefit? I mean, no, I know the dangers to people, but what benefits do they serve environmentally?
It's a great question. I don't know that I have an answer for that.
It's not something that I've ever even thought of before, but it seems like everything must have a purpose.
Yeah, why are they here, right? Mm-hmm. I wonder if their purpose is to keep population down of
people,
different creatures, animals, people. I don't know. It's a good question though, Mary. I would love to know an answer to that.
Me too.
I really think that there are a few things like earwigs that just have no purpose whatsoever and should not be here.
That we know about anyway, because we're always,
right.
You know, for a long time they thought their appendix had no purpose, and I think now they're discovering it does. I forgot what it is, but
it's the appendix. The appendix is just kind of like a auxiliary cleansing organ. It's just helping the digestive system do its work.
Okay.
But yeah, earwigs, not a fan. Thumbs down. Yeah.
Not very beautiful anyway.
No, it's true. And ticks, similarly, I mean, the only thing I can think of is population control. But unfortunately, you know, most folks don't die of tick-borne infection. And that's kind of the worst part in some ways, is that people will have chronic infection for years, even decades. And it is difficult to diagnose because some people will have a tick transmit a smaller amount of bacteria, right? And even after those 2 to 3 weeks, the bacteria doesn't show up on people's labs, on people's blood work. And so doctors don't prescribe antibiotics and the infection goes untreated. And especially with things like Bartonella, you know, people develop things like chronic seizures, and it's really scary and really unfortunate, which is why I think it's good to have the herbal allies, not only preventatively with the astragalus, but from a treatment perspective too, right? Because especially if we know we have pulled an engorged tick off of ourselves, but maybe we don't get it tested or blood work doesn't come back showing signs of an infection, we can still take those herbs, right? And we can know that they're just as effective as oral doxycycline. And the nice thing about those herbs is that they can be effective in rotation with a few others for chronic tick-borne infections, to help people really get to the other side of a more long-term condition. And I think that's being more and more recognized. You know, even 5 years ago, the CDC didn't recognize chronic Lyme as a reality. And doctors were saying to patients, like, no, it's all in your head. It's stress. That's all that this is, right? But luckily now, this is being recognized and treated. So once a tick-borne infection goes untreated for more than 6 weeks to 2 months, I don't actually think antibiotics are the best course of action, because they wipe out intestinal flora and allow the bacteria, the spirochetes, to make a happy home in the intestines. So in that case, I think it's truly about using herbs to flush the bacteria out of the intestinal lining, to flush it out of the liver, out of any other organs, the neurological system, the lymphatic system, so that folks can start to feel better. And the antibiotics aren't doing anyone any favors in that kind of condition. So that's important to remember as well. There's a great company in Brattleboro, Vermont, called Green Dragon. They're primarily, well, they started as a Chinese medicine company, but do more. And they have a great herbal protocol for tick-borne infections. There's also a company out on the West Coast called Herbalist and Alchemist. And they have a great protocol, 2 different tinctures that you kind of alternate and rotate through. And those can be helpful for sure. But yeah, I think also remembering that you may know you have an infection, but it's not showing up on blood work. Not just kind of letting that be, but addressing it yourself, and taking your health into your own hands is so important. Because again, the allopathic community is great for, an instance where I've broken my leg or had some other kind of trauma, right? Or even, treating an acute infection like Lyme, but not so great at dealing with the more subtle aspects of health, which is why it's important to take our health into our own hands if we're not feeling well, and still aren't receiving treatment. What else? What other questions do people have?
Did you say herbalists and alchemists on the West Coast?
Mm-hmm.
So that's different from David Winston.
It is originally his company, yeah.
Really? Okay.
Although not any longer. He's kind of retired for the most part. Yeah, yeah. He's almost 80.
You're kidding.
Believe it or not. Yeah.
Okay.
Yeah. My brother actually took over for him at Traditional Medicinals, the tea company. He was head of research and development there for many, many years.
Oh my.
I know.
Me and Rosemary go way back then.
Oh, yes. Oh, yes. So yeah, I
You
think.
had a place in New Jersey, but I had no idea you had one on the West Coast.
Mm-hmm.
Huh,
Mm-hmm.
interesting.
Yeah. Yeah. Um, so I think it's good to have those kinds of things on hand, certainly taking astragalus, but also, if you want to go on Woodland Essence's website and get those other three, the Cryptolepis knotweed and Baikal skullcap, then at least you have them. And if and when you start to feel symptoms coming on, regardless of what lab work is saying, you can have those herbs on hand.
Lisa, can you start them then? Like if you see a tick bite on you, and you see a live tick on you, can you start those 3 herbs right away?
I would say, because they're very strong, they're very effective, I would say only start if that tick was engorged and it had been on for more than 24 hours, between 24 and 36 hours. That would be cause for concern. And I would say wait, because if you start trying to kind of take down the infection before it fully blooms, it won't be as effective. So I would say wait a week to 10 days before starting to treat yourself herbally. But yeah, absolutely. And that is, of course, if you don't plan to get blood work, because if you start treating yourself and then you get blood work, the infection might not show up because you're treating it. So yeah, it all depends on kind of your course of action. And before getting Lyme disease myself, I didn't really think, thoroughly about these things. I didn't have those herbs on hand. So I kind of went, straight for the antibiotics. And I think that was probably a good idea, just to really make sure the infection was eradicated when it was still in the acute phase. And I did still follow up with herbs. But had the oral doxycycline been my only option, I would have opted for the herbs, just because of how disruptive doxy in particular is to the gut microbiome. I definitely would have opted for the herbs because I wouldn't have been able to complete the 21-day course that they would have prescribed, just because I don't know if any of you has taken antibiotics for that long, but it's highly unpleasant. Even when taking probiotics away from the antibiotics, it still feels like digesting anything is nearly impossible. I don't recommend it. Yeah, have either of you ever had a tick-borne illness? Good. Wonderful.
I had tick bites, and then I was checked by my doctor, and it came negative. But I probably didn't put any time other than how long it took to get the appointment to see the doctor. So it happened later. So
interesting.
I really don't know.
Yeah. Yeah. But as long as you're not showing those symptoms of chronic Lyme or chronic tick infection, I think you have nothing to worry about.
And I have major digestive issues in that I have celiac disease. So its treatment has been lack of gluten. So, I think probably in the last 15 plus years that I've been diagnosed, I've had maybe 3 accidental exposures to gluten where I was told that, but I know my digestion is not strong.
Right.
I have been able to take certain antibiotics in the past for the full course without major, but that I did do the probiotics, apart from it.
That's good.
Yeah.
That's good. Yeah. And wonderful that neither one of you has had to experience that.
Yeah. And where we live now, there's an area either there or one near our building, just outside this window, where we will eventually be able to grow. It's
Great.
whether or not it's if we're going to share one other buildings or if we're going to have our own. But they sprayed pesticides here just a couple days.
Oh no.
I know, and then they were pretending when I was talking to the administration, happened to be in the office where I was. They were pretending like, oh no, we don't spray. And there's, well, it must have been, and they named the company. It's like, but they're the ones that hired that company to come out.
Yes.
And just because, then they're acting like it's not they. And it's like, I'm not going to walk over there, much less grow food.
No, absolutely.
Well, I'll walk over there in a few days, after the rain and stuff. But
yeah,
because it's everywhere, it's impossible, even the North and South poles, to be totally away from herbicides and pesticides.
Yes, it's disappointing, and the effect they have on our endocrine system is really
major.
Yeah,
really
quite challenging.
People don't realize, and they think we're weird because we react, but we're just showing everybody else what it's like.
Yeah.
But our son David, who has special needs, was invited to attend a church service yesterday, so we drove him over there. And I have been wondering where I can grow food here. So we joined the CSA for this year, hoping I would be able to talk to CSA into a plot for growing herbs, or something, or find somebody in the community who has a house that they wouldn't mind. I almost found, but that particular church has 15 people come to services, so it's really tiny. They have this plot that was used until last year as a community garden, and the
amazing.
Got too old or something, and they have water, and they covered it with black plastic, which I'm not really fond of, but to try to keep the weeds down. So I'm going to try to, I think they were trying to encourage me that if I wanted to do it. Yeah.
Great.
So I'm hoping, I'm just trying to get, should I think just myself, or because I don't know people in the general community to try to not do it alone, other than people who might want to grow flowers here in the building, but more herbs and medicinals. And
that's wonderful. What a good resource.
Yeah, we'll see if it works. It's like, whoa.
Yeah.
So I thought you needed to pray for these kinds of things, no matter what the religion, that you kind of needed to pray. I just thought it a few times, and here it's like, whoa, right in my lap. Or so it seems so far.
Bye, Judith. Nice to see you. Happy full moon. Well, that's wonderful, Mary.
Yeah, so we'll see what happens.
Yeah.
It feels like the world's just full of new options right now.
That's right. Yeah, and you can enjoy.
That's right.
And enjoy everything you get from your CSA too. That's very special.
Yeah, it's a really good one.
Wonderful. Well, it's wonderful to see you.
It's great to see you too. Thanks for, I'm so sorry you had to go through this.
Me too, and it's how I learn. I'm so grateful for the learning.
Exactly. And before I forget, I love your earrings.
Thank you.
I only see one of them, but it's absolutely stunning. It looks very Native American.
There's a jeweler in Montpelier here. His name is Lachlan Smith. You can look him up. He has an Etsy shop. And if you're, can you see them better?
Yeah.
If you're from Montpelier and you like earrings, you probably have a pair of his earrings.
Wow. Can you give me his name again? I couldn't hear you.
Lachlan, Lochlin, Lachlan Smith. Yeah, he makes fun earrings, and he makes necklaces, bracelets too.
Okay, I'm more of an earring person.
Yeah, I hear
you. Great, thanks for sharing. That's a wonderful resource. And his name is one word or two, Lachlan Smith?
Lachlan is one word, and then Smith is his last name.
Okay. Thanks.
Yeah, take
Fun.
care, Mary.
Yeah, you too. Happy
And we'll see
summer.
you. Yeah, see you
Okay.
soon.
That's right. Take care. Good night. I mean, good afternoon. I'm ready to
Bye.
go back to bed. Good night. Take care.